Most deadly viruses are unavoidable. It is very challenging to predict when the next pandemic will occur. A few months ago, the coronavirus took over our lives. Many pandemics in the past had the same results, like the Asian flu. The Asian flu and coronavirus have many similarities with their effects and symptoms, but also many differences. The media has influenced behavior heavily, both positively and negatively, making it hard to judge accurate from inaccurate information once the media gets involved. A new virus was developed in East Asia. The virus was first reported in Singapore in February 1957, and then traveled to Hong Kong in April 1957. Eventually, the virus ended up in coastal cities in the United States in the summer of 1957. According to the Centers for Disease Control and Prevention, the estimated number of deaths was 1.1 million worldwide. Over 100,000 of those deaths were in the United States. The Asian flu has symptoms that are very similar to other strains of influenza, including fever, body aches, chills, cough, and loss of appetite. According to Sinobiological, influenza is considered a respiratory illness, so a dry cough and difficulty breathing are reported among flu sufferers. Influenza usually results in a high fever and body aches, or chills. The outbreak was caused by a virus known as influenza H2N2. Kara Rogers states that research has indicated that the virus was a mixed species strain, originating from strains of avian influenza and human influenza. The Asian flu originated from a mutation in wild ducks, combining with a pre-existing human strain. In 1957, a vaccine was introduced and the pandemic started to slow down. Here's an ad that was created to get people to get the vaccines.
Vaccination is your only protection against Asian influenza. Be sure you and every member of your family have this protection in time. Once the disease strikes your community, it is too late for vaccination. See your doctor or health department now.
Advertisements like the video that was just played were created to get people to sign up and get the vaccine. It was very likely that ads like these were played in classrooms for students to see or in stores. A lot of information about the vaccine were commonly found in newspapers. Back then, there were very different ways of communication through news. Now, most of our ads are seen through social media or television. The outbreak of the coronavirus started in China in December 2019. The spread of this virus is growing to multiple countries worldwide. The virus is fairly new, so scientists are learning new information about it each day. COVID-19 got its name for the crown-like spikes on the surface of the virus. The coronavirus causes symptoms including fever, headache, and respiratory problems like cough and shortness of breath. When getting tested for the virus, samples are usually collected from a person's nose or throat with swabs. Doctors swabbing the back of the nasal cavity through the nostril is the best way to collect a sample. According to NCIRD, there are many types of human coronaviruses, including some that commonly use mild upper respiratory tract illnesses. COVID-19 is a new disease caused by a new coronavirus that has not previously been seen in humans. Here is a video from the new campaign launched by the NCDHHS urging North Carolinians to wear a mask to help stop the spread of COVID-19.
You can't know someone has COVID-19 just by looking at them. Anyone can get it. But while you can't know who is carrying the virus, you should know that everyone who wears a mask has a reason to fight it. Whatever your reason, get behind the mask.
There are many similarities and differences when comparing the two pandemics. Both viruses took place at different times, but had very similar problems. COVID-19 and the Asian flu both cause respiratory disease. This presents a wide range of illness, whether you're asymptomatic, have mild symptoms, or severe symptoms that cause death. Both viruses are transmitted by contact with other people. With that being said, hygiene practices like washing hands and using hand sanitizer anytime you go into a store are crucial actions to prevent getting the virus. According to the report of the World Health Organization, the Asian flu killed an estimated 70,000 to 116,000 Americans and 1 to 4 million people worldwide, but experts suggest it would have killed many more if it wasn't for the vaccine. As of April 18, 2020, the current outbreak of COVID-19 has affected over 2 million people and killed more than 100,000 people in more than 200 countries throughout the world. After both viruses struck, many people died, the economy was affected, and we had to take different approaches when it comes to preventing the virus. Although there are a lot of similarities, there are also differences within both viruses. For example, during the Asian flu, children were affected by the virus the most in the community. For COVID-19 virus, studies show that children are less affected than adults. While the range of symptoms for the two viruses are similar, the fraction with severe disease appears to be different. For COVID-19, data to date suggests that 80% of infections are mild or asymptomatic. According to the World Health Organization, limited data describes clinical manifestations of COVID-19 that are generally milder in children compared with adults, but also show that some children do require hospitalization and intensive care. These fractions would be higher than what is observed for influenza infection. They are both caused by different viruses. COVID-19 symptoms generally appear 2 to 14 days after exposure. The Asian flu symptoms usually appear about 1 or 4 days after exposure. The death rate for COVID is also higher compared to the Asian flu. Harvey Morris has lived through both the Asian flu and the coronavirus. There were many differences with these pandemics. He stated, "I don't recall anyone wearing a protective mask, and I'm not sure that hand sanitizer was even available." As we could see, we take the coronavirus much more seriously when it comes to protection compared to the Asian flu. Vaccines for the Asian flu were not distributed until months after the outbreak. To add on, vaccines were also extremely limited. There was a major lack of consistency in treatment. Most hospitals were closed when the doctors and nurses started to feel sick. Harvey Morris also stated, "The health ministry advised the public via the radio not to visit the doctor if they felt the flu coming on, but to stay home and take aspirin." Some hospital wards, nevertheless, were forced to close as staff fell ill. Up to a third of the community doctors caught the bug. There are many differences now with delivering information compared to in the 50s. The media has influenced behavior heavily, both positively and negatively. It can be very challenging to tell if the information we are told is accurate once the media gets involved. During the time of the Asian flu, most people got updates about the virus through the radio or in the newspapers. When the Asian flu first broke out, many news sources got their information straight from the doctors. It is much different compared to how we get information today. Most of the facts that we get today are from the internet, social media, and television. A lot of the information that we receive today are false. Majority of the time, we look up something on the internet, and the first thing that pops up we rely on. It is very easy to get blindsided by what we see on social media, and this can affect the accuracy of information we read about. We saw two videos, one from the time period of the Asian flu and another video that was made a few months ago. When comparing these videos, we could see how the video about COVID provides more information and is clearer compared to the video about the Asian flu.